Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate, and tonight we're going to focus on high blood pressure or hypertension. And, May is actually Blood Pressure Awareness Month. So it's a great time to really take time out and to talk about this in detail and its importance, and more importantly, what you can do without the use of drugs, with lifestyle to improve your blood pressure. It's really important. So let's talk about the prevalence of it. Make no mistake about it, hypertension, it remains the number one risk factor for coronary artery disease. And it also is a major risk factor for stroke, heart failure, kidney failure, and even dementia. So it's prevalent, and it's really important to know it. Nearly half of Americans, nearly half, that's 47%, or 116 million to be exact, people have hypertension in this country. So it's extremely common. And in case you want a little more information, a little more facts, 7 out of 10 people that have their first heart attack are hypertensive. And 8 out of every 10 people that have their first stroke have high blood pressure. So that's what we're dealing with. It may be quiet, it may be pervasive, but it kills. And that's why it's called the silent killer, because you don't have any symptoms whatsoever. Actually, I prefer when my patients have symptoms because it's kind of a barometer of what's going on. Because without symptoms, you can feel pretty good. So it's most important to know your numbers. It's the leading cause of death, and it's the third leading cause of death in the United States. So you have to know your numbers. And most important, the numbers change. This is not a stagnant thing, okay? It changes from day to day, from hour to hour. It can change the course of when a patient comes to my office. The nurse usually checks the blood pressure as soon as the patient comes in. I talk to the patient, then I kind of sneak up on them, and I do the physical exam. And then when they're not really noticing, I take their blood pressure a second time. It can be quite different than when the nurse first took it when they entered the room. So it's important to know. 2 important aspects I always mention in dealing with hypertension. Number 1, knowledge. You have to know your numbers. You have to know the prevalence of this disorder. Number 2, action. You have to have an action plan. It ain't going to go away by itself. And even if you're on drugs, it's not enough. So I'm always asked this question, what is the typical what is the normal blood pressure for a 20-year-old or a 60-year-old or whatever? I'm always asked this question. And actually, the answer is always the same. I don't care whether you're 20 years old, 30 years old, 50 years old, 70, 80, 90, or even 100. Always going to tell you the same. 120 over 70 is the ideal blood pressure. Now, does that mean I try to get 120 over 70 in all my patients? Absolutely not. If I did that, you would be on 3 or more medications. I have to see you in my office every 4 to 6 weeks. It just isn't practical. But that is the aim. That is the ideal blood pressure. But we have guidelines. So we really like it to be less than 130 for the top or systolic, and less than 80 for the diastolic or the bottom. So let's say you're 131 over 81. You're hypertensive. I don't care what anybody tells you. The numbers may not seem that high, but you are hypertensive. Now, when I was a student, a gazillion years ago, we used 140 over 90. And that was just borderline. And guess what? We didn't even treat it. We just said, oh, you got borderline hypertension. That's not borderline. That's clearly elevated. And the other thing you need to know about is that it changes in the course of a day. For example, in the morning when our stress hormones are raging, like cortisol and epinephrine, norepinephrine, the blood pressure tends to be higher. As the day goes on, usually the blood pressure tapers off and gets lower. Now, after exercise, usually the arteries actually help to dilate. The exercise helps to dilate the arteries, and blood pressure will often come down as well. So if you check it like half hour after your exercise, you'll see that the blood pressure is actually a bit lower. But some people have a paradoxical response. I have some patients that have it's normal in the morning, but it's high in the evening. So all bets are off. But generally that is the diurnal pattern that we see. Now, the surprising facts, couple that I have about hypertension, it is linked to dementia and Alzheimer's, as well as small vessel disease. Small vessels like vascular dementia, very commonly caused by hypertension. And this can sneak up on the individual. And it's thought, and this is very important, it's thought that hypertension in middle age is most important in portending a negative response or to dementia as you get older. So it's really important that we treat people in before they're 60 or 65, because that's really the important years in how much you thwart dementia. But young people can have hypertension too. It's not just an elderly population. So again, the systolic or the top number is when the heart's contracting or squeezing, and the diastolic is when the heart is relaxing and getting blood for the next beat. So that's why the two are, where we have a systolic and a diastolic. So people say, well, do we have to treat both? What's important? Now, when I was a student back in those days, when 140 over 90 was considered borderline, we just treated the diastolic. I mean, if your blood pressure was 160, 170 over 80, we didn't treat it because your diastolic was normal. I mean, we just didn't have that knowledge until the 80s, when I was a fellow. You had this landmark study that came out called the SHEP, SHEP, systolic hypertension in the elderly population. And they proved, without a shadow of a doubt, that the top number, the systolic blood pressure, was just as important in causing heart attacks and strokes as the bottom number. So that kind of revolutionized or changed how we treat hypertension. Also, a couple other things. As far as the epidemiology, it's more common in men than females. So 51% of men are hypertensive and 39.7% in females. And also, if you look into races, it's definitely blacks have a higher incidence of blood pressure. The prevalence is about 47% and 51% in blacks. Wait a minute. I get it wrong. Can't think of it. It's definitely about 12% more commonly seen in blacks than whites. So that's definitely a thing to consider. But here's the bottom line, folks. If one of your parents is hypertensive, you have a 25% chance of being hypertensive yourself. If both parents are hypertensive, that number climbs to 50%. So it clearly is a genetic tendency here. And here's the figures for blacks: 57% blacks versus 43.7% whites. So there is a racial difference. So what do we know? So we know that it does climb with age. There's a diurnal pattern, higher in the morning and the evening. And we also know that exercise helps. Now, exercise helps to relax the blood vessels, so there's less pressure for the blood to pump. So, like I said, it will come down with exercise. 92% of people with hypertension have what's called essential hypertension. I don't really know where that word comes from, but it means we don't really know what causes this. We know it's genetic. We know that it has a diurnal pattern. We know a lot about it, but we don't know what actually causes it. But we may be finding that out soon, and I'll tell you why. And the other thing is that there's really no cure. I mean, once you're hypertensive, you are hypertensive, but it can be easily, or maybe not easily, but it can and should be controlled. And that's what I'm all about. Now, we're going to be learning more. I think there's a new test that I'm very excited about. I've mentioned this in the past. It's a test called Cardia, CARDIAX, by a company called Vibrant America. And they have a subdivision now called Vibrant Wellness. And it's really a great lab. And they're testing for 25 genes for heart disease, 29 genes for heart disease alone. That's incredible. And they're looking for genetic polymorphisms, what we call SNPs, SNPs. And again, they measure 25 genes, and they're checking for genetic tendency toward hypertension, high cholesterol, diabetes, insulin resistance, atrial fibrillation, stroke. So we'll be able to really tell a lot of information genetically who's prone for what. So why do we even, need more information? Well, we're all, and if you're listening to me, you know that I'm all about being your own medical advocate. So as medical advocates, we want to reduce the prevalence of heart disease, and we do it by early risk factor detection. So why wait for an event to happen? Too many people are dropping dead of heart attacks, like Herbert just happened to the anchor on television. I can't forget his name now. Anyway, dropped dead of a massive heart attack. So we want to focus on early detection and prevention ultimately. So who should be tested? Who would be, first of all, the test, it's not cheap. Usually functional medicine tests and genetic tests are not covered by insurance. I'm sorry, but they don't care about your future. They really don't. I do, but they don't. But it's about $350, which I think is pretty worthwhile for a test that tests for 25 different genes. So if you have a positive family history of hypertension or heart disease, definitely if you have poorly controlled or uncontrolled hypertension, if you have a history of events, you've had a heart attack or two, I would get checked out. If you have metabolic syndrome or prediabetes or diabetes, and again, 95% of the population in this country is metabolically unhealthy. So that basically both for all of us. And also inflammatory markers. Inflammation is a big deal. So it's an exciting era because I think we're going to get a lot more information and we'll finally learn what actually causes hypertension because we haven't known up to this point. It kind of gives a new meaning to it because, as I wrote in my book, which I guess now is out of date, at least this one part, is that treating hypertension is like trial and error. We're going to put you this medication because it's well tolerated and I think you'll do well with it. I don't really know what's going to work. I don't have the basis to know that. I have a crystal ball. So it is trial and error to an extent. But with the knowledge of this new test and knowing your SNPs, your genetic polymorphisms, we'll be able to say, well, this person will do better on a low-salt diet versus a normal diet, or this person would do better with a diuretic. This person may do better with certain supplements. This person may be better with beta blockers or ACE inhibitors. You see what I'm saying? In other words, we'll have genetic information saying to be able to tell you what patients do well with what type of therapy. So the end result, your blood pressure will be controlled sooner and better. And that's the benefit of doing functional medicine tests, especially genetic tests like this. But it isn't all about your genes, okay? Now, I've said it before, and I'll say it again. Up until a year or so ago, we thought that about 30% of your clinical outcome was really dependent on your genes, and 80%, 70% lifestyle. Well, and that's been changed. Now, the new thinking is that only 10% is really related to your your genetic, your genome, and 90% is lifestyle. So that's why we use the word epigenetics. Epigenetics is taking your genes and changing them. We can't really change your genes. We can change how they are expressed. That is the word expression. So what does that mean? Think of a revolver. I've had the revolver on this desk right now, and that's your genome. Nothing's going to happen. It's just sitting there, right? Once I pull that trigger, something happens. And that's kind of my analogy when I talk about epigenetics. Once the trigger is pulled, then we see what's expressed and what's not expressed. And this is really important because we want good genes to be expressed. We want bad genes to be suppressed. And that's the whole concept between gene expression. So what do we know about gene expression? We know that inflammation is bad. It's bad for everything. It's bad for heart disease, cancer, autoimmune disorders, and also Alzheimer's. So inflammation in itself, that's chronic, will actually, suppress good genes and activate bad genes. We don't like that. Also, oxidative stress or free radicals. And the other thing is vascular dysfunction. Those that know me well, I always talk about the endothelium. That's the inside lining of all 60,000 miles of blood vessels that we have, 60,000 miles. And as long as that's intact, you're healthy. But when that becomes non-elastic, and then there's problems. So we have oxidative stress, we have inflammation and endothelial dysfunction, and all those have a negative effect on your genome, more specifically your epigenetics. So it's a really exciting era, and maybe next year when I give this talk, I have a few more comments to say, but I think this is going to be really important testing, and it's worth spending the money because I think the information you can't get anywhere else. Now let's talk about treatment. I always stress lifestyle first. There's no question about it. Weight loss and exercise are the two number things. Weight loss and exercise in that order. Now, how do I know about that? Well, for every pound of weight loss, and this is a known fact, for every pound of weight loss, you can lose a half a millimeter of mercury in your blood pressure. Diastolic or systolic, it does not matter. Both. Now, that's not a big deal, is it? I said, yeah, it is a big deal because if you lose 10 pounds, you'll lose 5 points in your blood pressure. If you lose 20 pounds, depending on how much weight you have to lose, if you lose 20 pounds, that could reduce your blood pressure numbers by 10 millimeters of mercury, systolic, diastolic, or both. So, I mean, it's really the number one thing to emphasize when it comes to blood pressure. I had someone come to me this week. Well, they're putting me on medication because I can't lose weight. I've tried. I took one look at this person. I knew that well, I don't know how hard she's really tried. My first time seeing her. You have to be really motivated. And to me, if treating hypertension is important enough motivation factor, I don't know what is. But weight loss is number one. Number two is exercise. I already told you the beneficial effects of exercise. It relaxes the blood vessels. And I believe when it comes to like cardio, aerobic exercise, you can have anywhere from a 5 to 8 millimeter reduction in systolic or diastolic pressure, blood pressure with exercise. And that can last up to 13 hours post activity. So if you take 5 millimeters of mercury here and 7 or 8 millimeters of mercury there, see if you combine exercise and weight loss together, you got a good combination. And that's as good as a lot of medication. So it's not insignificant, folks. It's really important. And what about resistance training? You know, if you know that I'm a bodybuilder, and I stress weight training. I've done many lectures on this because muscle really is your ticket to longevity. It's your organ of longevity. And we know that if you want to reach an old age and not end up in a nursing home, having muscle is really important. So those of you that know me, that I lost my partner in November of 2022, and he had end-stage cancer, kidney cancer. I don't think that really actually killed him because of the muscle. He lost all of his muscle mass, all of it. It was amazing to see. We call it cachexia in cancer patients. But we also know from looking with cancer studies that you can, even if you have stage 4 cancer, you can slow down the progression of the disease and the metastasis by exercise. So unfortunately, he wasn't able to do that. So we saw him have a demise. He still lives 8.5 years. It's pretty remarkable with stage 4 cancer. But resistance training plays a definite role, and we know that now. And it also plays a role in 24-hour period of reducing your blood pressure. It's not just cardio. Cardio is important, but so is weight training. Okay, hydration. I'm really big on hydration. Did you know that 75% of adults in this country are clinically dehydrated? If you don't hydrate your cells, the cells are going to undergo oxidative stress and they become inflamed, and then blood pressure rises as a result. It's not a good thing. We have to stay hydrated. And we're not like dogs and cats. They have a very good thirst mechanism. We don't. So by the time we are clinically thirsty, we're about a liter behind already. So you have to bring people that bring the water bottles with them, they're smart because we need to stay well hydrated. Alcohol and smoking, no question, both of those have a major effect on your blood pressure. Also, uncorrected sleep apnea. Now, I had a patient years ago. I was young in practice, and I could not control his blood pressure. I couldn't figure. I'm having 2, 3 medications. He also was a bit overweight, and he was a chef in a restaurant, which I'm sure didn't help. But and I finally figured out, we had diagnosed him as having sleep apnea. Sleep studies were kind of new then. We're talking like 25 years ago, okay? And blood pressure came under control just by treating this sleep apnea. So that's another known factor. So we have to also look at all these things that are happening in the patient's environment and what can we do about it. Biofeedback is important. That's kind of using external mechanisms or, I guess instruments to actually help control your body. Otherwise, I used to be a runner way before I became a bodybuilder, and I would wear a heart rate monitor, and I would say, okay, I'm going to go up this hill, but I'm not going to let my heart rate get above 130. Now, of course, I'm obviously slowing myself down, but I'm pacing myself based on my brain telling my body what it's going to do. That's biofeedback. Lots of different ways of doing it. There's one that I've investigated in the past, and I've mentioned in the past. It's called Respirate. That's capital RESP, little e, capital RATE, Respirate. You can find it on the internet. It's about $350. The reason why I mention it is because it's actually FDA approved and also endorsed by the American Heart Association, which is a very conservative organization, as you probably know. So, and it just basically works on slowing your breathing process down. Do you need it? Well, I don't need it, but I'm not hypertensive. But it depends if you can work on slowing your breathing by yourself. This helps. It uses musical tones, And I believe in that. Yeah, I think using music is very calming and very soothing. And you can lower your blood pressure in as little as like, it takes about between 4 and 8 weeks. You can get a pretty good response. They have like 13 or 14 clinical studies. So it's worth looking into. Again, 350 is the cost of the genetic test I was telling you about. Respirate, capital RESP, little e, capital RATE. And I haven't used it, um, but I think it's something worth looking into, because I think it's a small price to pay for blood pressure control. But the other thing is breathing. So I really work on breathing every day. It's part of my meditation practice. So if we need to slow the rate of our breathing. So let's say the average breath rate is like 16 to 18. We're breathing too fast. You can slow it down by practicing breathing. So you'll know how I do this. I breathe in my nose for 4. I hold for 2 as I say to myself, 1001, 1002, and I breathe out for 6. And I put my teeth together and I do a hissing sound so I can hear my exhalation. Now, box breathing is 4-4-4, and mine is 4-2-6. Like I said before, I like mine better because I'm really working on exhalation, and that's where we fail. That's where we tend to breathe too fast. So we'll do one for you. Simple, right? But you got to do it, and you got to do it every day. And so I do it as soon as I get up in the morning. I prop myself up against my bedpost, and before I get out of bed, and I work on my breathing. And I do it over and over again. I use a counting method. You can do whatever method you want. And there's also tapes that you can use. But these are ways to slow your breathing down. And it's a form of using biofeedback without using instruments. Um, a couple other things that I like. Foods. Okay. Potassium-rich foods are really good. Potassium helps to decrease your blood pressure. I don't usually give potassium supplements, mostly because I don't really use diuretics in my practice, very rarely. So, and I think with too much, so I try to avoid using, supplements, potassium supplements, but you can use them. But tomato sauce, white beans, beans in general, cherries, fruits, veggies, essentially all fruits and veggies are full of potassium. So, potassium helps to lower blood pressure as opposed to sodium, which can possibly elevate it. Also, magnesium is an underused mineral. That is as effective as taking one medication for hypertension. Imagine one is effective as taking one medication. But what doctors talk about magnesium, in lieu of a medication? So remember, folks, magnesium and potassium together can help lower your blood pressure, and that's important. Supplements that I use. Okay, I have a few that I like. Coenzyme Q10, which is essential for the energy production in each cell in your body, especially your heart. So I would say at least 200 milligrams, 200 to 300 milligrams will help reduce blood pressure. Fish oil. I'm big on fish oil. And I especially DHA, which is good for the heart, vision, and also the brain. Hawthorn berry's been used. I think that's about 500 milligrams 2 or 3 times a day. All natural supplements. That's an herb. And I also, earthing is something good. I did a study with Dr. Stephen Sinatra, my mentor, several years ago on the effects of grounding or walking barefoot on soil or the grass or in sand on a beach. And that we've seen decreases in blood pressure with that. And the stress reduction we've talked about. And that's about it. I'm not, as far as sodium is concerned, you heard about that DASH diet that was very big many years ago. Dietary approaches to stop hypertension. I wasn't a big fan because they were pushing things like grains and stuff that I think is really last century medicine. And also, some people don't really need to be on a low sodium diet. So, how do you know if you're a sodium retainer? Well, take a high sodium meal and check your blood pressure a couple hours later, or see whether you're swelling in your fingertips and so forth. So, there's no test for if you're a sodium retainer. Usually, blocks. If I ever give a diuretic, it's to block because they tend to be sodium retainers more so than the Caucasians. But I don't have a blanket rule as far as lowering sodium in everyone. And that's it. We're not going to talk about drugs unless you have specific questions. Drugs are always there, but I will tell you one thing. When it comes to blood pressure reduction, if I have to use drugs, I will. I will, because it's so important to lower blood pressure. So I always use lifestyle first. I press that upon everyone. But if you have to use medications, you use them, because having hypertension that's uncontrolled is detrimental to your health. So thanks for listening, and I'm going to put my glasses on and see if I can read these small print for these questions. Thank you guys, great audience. Okay, starting at the bottom here with sleep apnea, why does it cause hypertension? It's just a major stress on your body. So you have to remember, in with sleep apnea, it isn't a problem with your heart. It isn't a problem with your lungs or a problem with your brain. The problem is your airway. So your airway doesn't have enough room. So what happens? You're not getting enough air in. The brain senses a drop in the oxygen saturation. So it has to work hard. So then you start gasping for air and you breathe fast. That's a big stress on the heart. Remember, the heart and lungs are interrelated. They need each other. The heart needs the lungs need the heart. So once that happens and the patient's apnea, the heart has to work hard and the heart rate increases and the blood pressure increases. And over a period of time, it becomes chronic. So it's a good question, and it's very common. Considering doing a lecture on inflammation, I will. I've done a video on it. I'll do that. Thank you. That's something I want to do in the near future. Okay, inflammation seems to be a bigger problem than it's talked about in medicals. Well, you're right. Inflammation is very big. Like I said before, it's not just heart disease. It's heart disease, cancer, autoimmune disorders, and Alzheimer's. So those are the four biggies, right? The four biggies of aging. So and they're all inflammation, and you see it plays such a big role in hypertension and also in gene expression. So I will talk about that. Good thing. Okay, what medications do you find works the best? Again, Sam Rubin. Thank you. That was the guy's name. I had a brain freeze. Thank you, Cheryl. But I mean, he just recently died, right? And no one expected, massive heart attack, younger than me. Um, Mud medications, I tend to, first of all, it is trial and error, but I think hopefully when I get more involved with this gene testing from Cardia X, from Vibrant Wellness, I'll be able to have an idea. Okay, this person will do better with this medication or this kind of diet. And that information we've never really had. It is trial and error. So I'd like to see, hopefully we'll have less of that in the near future. I like ACE inhibitors. I use less and less of now because of the incidence of cough. So if you're Asian, you have a higher incidence of cough. If you're, about 12% or more of people have a dry hacking cough that can be very bothersome with ACE inhibitors. So then I use something called an ARB, which is an angiotensin receptor blocker, which is kind of in the similar family as ACE inhibitors, but it's a different. It's a step above the pathway, so you don't have it obvious the need of there's no cough involved. That's pretty well tolerated. I like it because usually it's once a day medication. It doesn't work right away. But I do use them. That's probably my medication of choice. If I have to get the blood pressure fat down because it's really high, I'll probably add a calcium channel blocker, like amlodipine is very common. But calcium channel blockers cause swelling, and most people don't want to see edema in their legs, especially women. So, but those are the drugs that I typically use. We have other drugs. We have vasodilators that are strong, that have been around forever, and that's commonly used in hard cases. I have some tough cases. Um, there are also some that work on centrally in the brain, like counterpress, for example. So if you have to use more than one medication, you want to use medication that works a different pathway as opposed to two of the same. So I have a lot of experience with medications. More than I'd like to say, because the average person doesn't do the work. They're not going out there working on lifestyle. Like I said, this lady that came in this week, she said, "I've tried everything, but I can't lose weight." I'm taking one look at her. I didn't feel that way, but I don't want to judge. I'm not into fat bashing, but anyway. Okay, let's see. Does packaged food? Oh my God! See, here's the thing. Most salt, this sodium issue. It's not the salt shaker. Okay, it's processed foods. Just take a look at processed foods and also look at fast food and check out the sodium content. It's ridiculous. It's ridiculous. Yeah, package. I mean, listen. Here's my thing: if it's in a can or bag or box, it doesn't belong on your plate. If you do use anything canned, like vegetables, get rid of the water in it and flush it out and rinse it off. and then eat it if you have to. But it's they're chock full of sodium because they're into preservatives. I did a recent post on Instagram. I don't know if any of you saw it. So I thought, okay, French fries, McDonald's French fries. We know how bad they are, but it's oil, potatoes, and salt, right? Are you kidding me? There were like 26 ingredients, most of which I couldn't even pronounce nor spell. That's what they have in McDonald's French fries. 26 different ingredients, colors, numbers, you know. So you can't trust anything that's in that fast food, or it just doesn't exist. So thanks for bringing that up, Brocco, because that's a big problem. Okay, what do I think about the carnivore diet? Carnivore diet is pretty good. I don't like it. I can say I don't like any strict diets that strict for all time. I think if you have gut issues, and it's very prevalent in this country, that being on a carnivore diet can help because it doesn't cause the gas and the bloating and the abdominal discomfort that you get with gassy foods like vegetables. So going on a carnivore diet for 2 or 3 months is not a bad idea to help clear up your gut. But would I say that long term? No, because you're definitely going to miss out on micronutrients. And same thing with vegan diet, by the way. Same thing with vegan diet. All vegans are not healthy. So if you're going to be a vegan or a carnivore, which are two extremes, I would do micronutrient testing. And if you go to any functional medicine doctors, like what we do in my office, we can test your micronutrients. And that's looking at nutrients in the cellular level, which you can't tell with a regular LabCorp or Quest lab. You have to look at the intracellular nutrient, and we can get that information. You may be low in certain vitamins and minerals that you have no idea about. So again, that's with extreme diets. Um, so great thing. Okay, keto diet. Keto diet is also it's kind of extreme, but it's not quite like carnivore. There's different types of keto diet. You can have keto diets that emphasize all out vegetables, which I think is good. You need the polyphenols, and you're not getting that with the carnivore diet. So I'm a there, but keto is not just a general term anymore. Just like Mediterranean diets, there's different types. So if you're going to do keto, and I think it's extremely good for weight loss, metabolic syndrome, and diabetes. Um, I think also it's good for cognitive impairment, early Alzheimer's, excuse me, because the brain thrives in the presence of fat. That's it. Fat is where it's at as far as the brain's concerned. So there's some definite good things about keto diet. Let's see. Good questions tonight. Okay. Okay. Donuts and cupcakes and fast food. Is that your husband, Cheryl? Well, everybody loves that stuff, but it's dangerous. And I love them too, but I don't eat them. I may have one donut. I know, very rarely. Okay, let's see what else here. Oh, you're saying Sam Rubin like he loved? Okay, I didn't know that. Okay. Um, Anything else, guys? I know I took a lot of your time today because I had so much to say. Let me just make sure I didn't miss anything. Um, Thank you for the compliments here. I appreciate that. Sam Rubin, yeah. So he did eat garbage. Okay, thanks for clarifying that, Cheryl. I didn't know. I mean, he was overweight, so I figured, he didn't look healthy to me. But what I know, I don't really follow that. But see, you can't live a life like that and expect to live forever or to live a long, healthy life. So someone like that eats like that is to have an event. It's not unusual. We can't think that's unusual. It's not a question of if, it's a question of when. And if, even when Clinton was president, when he was, I mean, now he's like a vegan, he's skinny as a, rail, but, he had like a quadruple bypass and, he was a McDonald's free, loved it. So, hospital food, the worst. When I was in hospital about a year or so ago, I was there for 2 nights. Okay, I told them what I wanted to eat. This is a joke. What I get for breakfast? Cheerios, skim milk. When I asked for full fat milk, skim milk. Oh, toast with margarine. I said, margarine? Are you kidding me? I said, I don't eat margarine. I want butter. We don't have butter. I said, what is this? the 20th century. We're in the 21st century. We're still serving margarine. They serve garbage in the hospital. And about 15, maybe 20 years ago, I volunteered pro bono on my part to revamp the doctor's dining lounge and make it healthy choices, healthy options. You have no idea. And I was just doing it for free because I wanted to help out. I got resistance like you don't know. The doctor said, "Are you kidding me? We don't want your help. We like it just the way it is." Well, then you understand when I did that post on Instagram a few weeks ago that 55% of doctors in this country are obese or overweight. It's like, do what I say, but not what I do. I can't, I don't think, I can't understand that. So hospital food is bad. All right. Let me see. I'll just make sure I got everything done. You guys are great. I really appreciate the comments and the questions because it stimulates my brain. I like to be spontaneous, and I like the recommendation. So, thank you, Rocco. I will do on inflammation. I promise, because that's a very important. Uh, Bring your own food to the hospital. I do. I mean, if I had to go to the hospital today for a meeting, I did not go to the doctor's lounge. I go for my meeting and I leave, and I bring my lunch here. So I don't eat the food. As a patient, I had to, but it was terrible. Um, okay, 2 weeks from now, May's a big month. So today, well, I want to really talk about blood pressure since it's Blood Pressure Awareness Month. In 2 weeks, we're going to emphasize women's health because it's also Women's Health Month. It's really important. So if you have any questions about hormones and issues specific to women, please bring them because that's going to be I'm looking really excited. I'm really excited about that talk. June is Men's Health Month, so we're not going to leave the guys out. So, but usually it's the women that bring the guys into to the office or but guys are getting more interested in their health now, as I can see from here. So you guys are great. So that'll be June, but I promise, Rocco, I'll do an inflammation the next couple of months and a few other topics. But yeah, if you guys have recommendations, please let me know because that's important. Okay, I think that's it. I just make sure I answered all your questions, and it looks like I did. Okay, thank you guys. Oh, my little plug. If you haven't, please get my book, From Both Sides of the Table, When Doctor Becomes Patient. But see, it's the subtitle here, Become Your Own Medical Advocate. That's really what the book is about. Yes, I did become my own medical advocate, and that's what I'm branded as. But I want you to be your own medical advocate. Because, and I just profiled on Facebook this young gentleman who's from Tahiti, and no, Trinidad, excuse me. And he saw a doctor and said, "You're overweight." So, and he has family history of hypertension. He's black. And so he immediately puts him on not one, but two medicines and get ready to put him on a statin for cholesterol. I said, "No, I'm not going to take a statin." I said, "Okay, let's put you on blood pressure medication." So somehow I forgot he found out about me. And he came in and I wanted to work on lifestyle. So, and make a long story short, he's lost 30 pounds. He's exercising 5 times a week. He's a film producer, so he was living in the fast lane before. He's done all this work on himself, and now he's off all medication. So that's proof of the pudding. I profiled him on my Facebook, Instagram, because you can do this. You don't have to be a doctor or a nurse to be your own advocate. You just have to have the will, the desire to do it. So I'm so proud of him. DHEA for you. Okay, thank you. I will bring up DHEA for sure next month in Women's Health and also in men's health because I'm a big fan of DHEA. I really am. I think it's definitely a good part of our anti-aging arsenal. Thank you guys. I'm very grateful for you spending your Thursday evening with me. If you see any of my videos, please check the like button. Ratings really make a difference. And if you happen to get my book, read it, which I hope you will, please go back to the Amazon page and write a quick review because ratings really help. Thank you so much. We'll see you in 2 weeks, okay? Thank you. Have a good evening, everybody. Thanks again.